This episode of Beauty and the Surgeon podcast is brought to you by Let's Get Checked. Let's Get Checked is an online company dedicated to making professional health testing easy and accessible. Let's Get Checked offers fast, affordable, completely confidential at-home health tests from a range of tests from STDs, male and female hormones, and even COVID-19. Listeners of our podcast who are new to Let's Get Checked get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com, trylgc.com/beauty, BEAUTY, and be sure to use the code BEAUTY20, BEAUTY20 at checkout. Do it. Getting tested is important. It's the responsible thing to do, and you know how important I think it is to make sure you understand your labs. Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy, I'm a nutritional therapy practitioner. And I'm joined today, as always, by Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon.
I don't know if you've heard this before, but I'm very board-certified.
You are.
Yeah.
And yes, that's an important part of you being.
I'm working on posture. I'm sitting up straight. I got my chest out.
Like it.
Yeah.
I always ask you before we podcast if you're feeling like your tallest self. Are you feeling your tallest self?
I'm feeling very tall.
Dr. Jason Martin, he is feeling like his tallest self.
Yeah.
Him's tallest self.
Hims.
Wow, this is off to a great start.
Yeah, you got it going on.
I do. We have a great episode ahead of us. This is one of our favorite episodes to do. It's questions from you, the listener.
We love it.
If you are listening and you would like to be part of one of these episodes, all you have to do is leave me a voicemail or send me a text or an email.
What's the number, Amy? What's the number?
The phone number you can do that on is 303-630-9038. I do also pull comments from YouTube that are interesting, or even we've taken them from Instagram before. So if you follow us on Instagram, at Beauty and the Surgeon Podcast or at Jason Martin MD, anywhere you leave them.
You could email Amy if you want.
You can email me directly. My email is in the description box below. So if you're interested in hearing your question, if you're one of the people who left one, you can find the timestamps in the description as well. But you should listen to all of them because they're all
listen to everyone
great.
Else's. I mean, don't be hoggy. Listen to the other people's.
Right. So I do love your questions, and I do try and answer them all right away.
Yeah.
These were some good ones. We also have a picture that goes along with this. So if you're listening and you'd like to see the picture at the end, you're going to want to find us on YouTube at Jason Martin MD as well.
Very good.
Dr. Martin, are you ready for the first question?
I love this. This is by far my favorite episodes.
So our first question is actually a voicemail. So we will listen to that now.
Good.
Hi, my name is Tanya. I just watched your episode from a year ago that you did about breast enhancement without implants. I actually had breast implants for 16 years. I took them out a few years ago. And last year in 2020, I did the fat transfer because I had some just deformities from the removal of the implants because it was under the muscle, and I had some indentation in my chest. So I did fat transfer to fill in those areas. All the fat didn't survive. I just watched your episode, so I'm well informed on why. Another thing, the doctor removed the fat from my thighs, which is I had saddlebags. I'm not a big girl, I'm a skinny girl, but my fat deposits in that area, so I had like wide hips. My question is, does that fat actually come back? Because I miss my curviness, and how would it be able to come back? And that's my question. Thank you.
So we keep getting the Tanyas, right?
We've had a couple. Yeah. Yep.
You're never sure.
Yeah, I know. That's why I was glad she said it. So see, that's even more reason to leave
Thank
a voicemail, because I don't have to guess at how your name should be pronounced.
Yeah, perfect.
This is such a great question. And we touch on it a lot in our episode all about fat. We also talk about it in our episode about liposuction. And there's a lot of theories out there about, the mythical woman who had liposuction on her abdomen and then got a fat neck, or got fat on her arms, so
it's like an urban myth.
Yeah, it is. And we talk about
like the Yeti, or the, like you kind of feel like Bigfoot.
El Chupacabra.
Yeah. So a couple of things. Number one, if you watch the episode on breast enhancement without breast implants, so like with fat, you know that the best case scenario is 60% of the fat's going to make it. So it's really good that you were informed and empowered before you went into that procedure, knowing full well that at most 60% of what your end result will be right after surgery will last. If you do that in operative areas, it's probably less than 60%.
Or areas that are adhesed, like she kind of made it seem like there may have been
some scar tissue.
Yep.
Yeah. So it makes sense. We just did that case yesterday in the office, awake. Under local anesthesia, we took fat from the patient's saddlebags and her flanks, which is her, what do people call flanks?
The back butt.
No, this area over here.
Yeah, that's the flanks.
Okay.
That's the back butt.
Haunches? I don't know. Whatever the layperson term is. What is that, Nils?
Muffin top?
Yeah, muffin top. There you go. Muffin top. We took it from her muffin top and her saddlebags and we put it in her breast, and she had had a previous implant removal. So it works really well. We get this question a lot. I heard from my girlfriend's cousin's brother that if you take fat out, it will come back at a different place. Like it's angry and that it's deciding it's going to redistribute somewhere else. We get that question a lot.
We do. And the best way to describe this, and I want to say one comment. We had a patient years ago who we did liposuction of her saddlebags, and she was skinny like you and had these just kind of very big saddlebags for a person of her size. And we did, at the time, we were still doing smart lipo, this way back in the day. And she said, if I had known this existed when I was 18, I would have done everything within my power to save the money and do it because it was so transformative for her. So when you are thin and you have these abnormal fat deposits, they can really be very noticeable.
Right.
They're hard to hide.
Right.
And
even if you are, like you mentioned that you're curvy, the fact that you could be too curvy in one area and it could be really obvious, especially if you are skinny or small.
Yeah, especially if your legs are skinny and you have these saddlebags. So that was her fear. She said, it's not going to come back, is it? Because she was so ecstatic that it was gone. And the answer is, it's no. But if you think about it like a bowl full of marbles and you take out, there's 100 marbles in the jar and you take out 90. Well, there's only 10 marbles left. In theory, all your fat cells, we have a great episode about fat. Do you mind if I go deep on fat for a second?
Oh, go deep.
So there's hormonal sensing in the body and other nutritional factors that cause your fat cells to increase in size. Fat is it's storing, right? So when your fat cells grow, they're not making more fat cells per se. They do in extreme cases, but that's not what your body wants to do. It just wants to store stuff, right?
So, an easy way to think about it, you're born with a set number of fat cells.
Which is what it still is somewhat true. Yeah. Like your body
fat is somewhat set. It's just easier to think that way, yeah.
But they grow and shrink. So it's like a water balloon that at the fair where, you squirt the water at it and it fills up or it deflates. It's a similar idea. So your body is just looking for places to store excess. So it stores it in fat cells and they get bigger. So all the fat cells in your body are being signaled kind of simultaneously, but there are definitely maybe more fat cells in one part of your body, which is where you're going to see your fat get bigger quicker because there's more. So once you have an area like your saddlebags where you had the 100 marbles and now you only have 10, those fat cells, those 10 will still grow, but think of how much they'd have to grow to fill that jar again. So
they grow with weight gain. So as you gain weight, the fats, or maybe hormonal changes, anything, any signaling, any stimulus that causes it to grow, and you're not doubling the number of cells or dividing the cells. It's just the growth of the cell bigger and smaller. As you gain weight, the fat cells get bigger. As you lose weight, the fat cells get smaller.
Yeah. So if you think about that, what people tend to do who have one problem area or even two problem areas, so like this is where I store my fat, that's also where they notice it, right? So they notice the creep is what I call it. So if you tend to hold weight in your abdomen, let's say, right away when you're maybe putting on weight even without stepping on the scale because your pants are fitting a little snugger.
Oh yeah, we've all been in that situation, sister.
Now you have lipo on your abdomen and now your abdomen doesn't have as many fat cells to grow. Well, let's say you maybe gain 10 pounds. Well, you don't notice it because your pants still fit, right? Pants still fit, I'm good. Why are my arms all of a sudden jiggly? Because you've gained weight or you've added more storage. So you may not have noticed your arms getting big before because when you saw your stomach get big, that was your mental cue to be on top of it. When that cue goes away, that's why people get into that place where this is then the urban myth, so-and-so got a fat neck or got fat arms. Well, did they also gain weight? And the answer is always yes.
Almost always yes.
Well, it is, and it has to be. But I think people just you don't see it because you're not used to looking at that as your cue to, I'm gaining weight.
Also, there's scar tissue in the area that they treated, and that scar tissue inhibits the fat from actually expanding. It's like a straitjacket on fat. So that also limits the amount of fat to return. So it's very unlikely if you maintain your weight that your saddlebags will return.
Yeah. But if you don't maintain your weight, those 10 cells can eventually still get really big.
So the irony is if you did gain weight, the fat that they injected in your breast area would actually be
also
more
get bigger,
voluminous, and you would have a better result.
Maybe, but not necessarily.
That's kind of
Wouldn't necessarily
It
make
kind of
it
messes
better.
with your head a little bit. You
Bigger
know?
isn't always better.
Do you want the saddlebags you don't like back, or you want your breast back? I don't know. It's like a choice.
Well, but bigger isn't always better.
That's true. Maybe cut it in the middle.
Yep.
Gain a couple pounds.
But we've had people come into our office and say that they've consulted with other physicians prior to a fat transfer, and the doctor told them to gain 20 pounds. Do I need to gain 20 pounds? And what I say to that person is, could you maintain that? Would you be happy 20 pounds heavier? And would you be able to maintain that? And if they say, no, I struggle to gain weight as it is, then don't gain weight. You need to be at a stable weight for fat transfer to be the
gain
most
20
effective.
pounds, you do a fat transfer procedure,
And then you lose 20 pounds.
and then you lose 20 pounds. What do you think is going to happen to the fat that you re-injected in your breast?
It's also gone.
Yeah.
Yeah. So
come on.
yeah.
There's no way to trick the body.
The logic there I find
It's so stupid.
baffling.
Yeah, but I'm sure offices, whatever.
People have said that.
There's going to be some plastic surgeon office watching this and be like, Martin doesn't know what he's talking about. I'm like, that's fine. We can meet outside.
Yeah, but we managed to get amazingly good quality fat off of a patient who weighs less than 120 pounds. So it can be done.
Yeah.
Like if you have a skilled surgeon doing your
Right.
body contouring, they will find some fat.
The way you harvest the fat. Yesterday we used Beauty Fill, which is our new device, really good. We have, I think, an episode in one of our on YouTube on that. On a case like that where it's injected into the breast. We use Beauty Fill, but you can use different types of machines. One of them we talked about in our previous episodes was Pure Graft. You can use Phaser. It's the way you harvest that fat, the
And
way you
treat it.
the way you treat it, the way you re-inject it. All these things will make a difference in terms of fat grafting results. Fat grafting really is kind of tedious and technical. And you just can't just get fat and squirt it back in. It doesn't work that way.
Well, and patient health too is a huge
Yeah.
factor. If you are not vascularly healthy,
Right. If you're a smoker, if you're diabetic, if you drink a lot, if you're unhealthy, all these things. So it's a very complicated process. And with breast cancer reconstruction, you get fat grafting. Those patients who've had radiation, that decreases the ability of the fat to take. I mean, you can go on from there. Previous trauma, stress in your life after you do the fat transfer. You, for whatever reason, have to raise your blood pressure and heart rate. That's terrible for a fat graft in the first 3 to 4 weeks.
for any healing wound.
Compression on the injected area that compresses the small blood vessels that's bringing the blood to the fat graft itself. That can destroy a fat graft. Should I keep going?
Nope.
Okay.
We have a whole episode about fat too.
Yeah.
Yeah.
So, but I do think it's really interesting. You're not alone. So many people. It's weird. There must be some Facebook group where people talk about this all the time.
Well, or like our patient, you're just so happy with your results that you're afraid that it's going to come back.
Yeah, I see what you're saying.
Like I think for some people it really is just like, wow, like how do I not?
It seems like everyone has a story
happen?
of so-and-so had
Yeah.
liposuction and their fat grew somewhere else, and it's just because they gained weight after surgery.
Yeah. So you just notice it other places.
Tanya, that was
Thank
good.
you so much for that question. I do apologize. This one was a couple months old because I needed to get a bank of good ones. So thank you so much for leaving that voicemail. All right, here's one. This was actually a text. So this was a text to the office. And this patient, the short story is that she's 45 and actually she doesn't think she needs a facelift. But her question is about face type in general. So let me read the whole text. So I think I need a facelift. I feel
like that I'm talking to my daughter right now, reading a text from her girlfriend. Do you think this was mean what she said?
I don't want to do one of obviously there was something, if obviously there was something less invasive that actually works. I got very excited about AccuTite and FaceTite after listening to your podcast and seeing the results on YouTube. But then I called 2 of the best board-certified plastic surgeons in my area who haven't seen my face yet. Then she says, by the way, I'm 45. And guess what's coming? Jowls. Not hanging down or anything. I can just tell the skin is starting to lose
It's
with
integrity.
gravity.
Yeah.
Yep. And I know they are coming because every person in my family that is old has them. These doctors are very reputable. They both said that it doesn't work and they don't do it. I honestly don't know what to believe. I just need to know the truth. I don't have endless funds. I don't want to do things that aren't necessary. Can you please tell me the truth? Please. And I'm sorry you did not leave your name, so we're going to call you anonymous.
Yeah, but if whoever leaves messages, names are great because it's helpful and then you get to know it's you, but it's okay if you don't want to.
Yeah, if you don't want to leave a name, you don't have to. So
Gotcha.
Anonymous here. So we have talked a lot about this in the episode about your perfect facelift and also how to age like a Hollywood superstar, I think are 2 of the best ones to listen to because it is, I would tell this patient, if you're 45 and think you need a facelift, you do. You're not too young. You probably do need a facelift. FaceTite is amazing. It does work. It's not magic and it's not formal surgery.
Right. So I'm sure the doctors or their offices were just saying what they think is correct.
Right. And if you don't have that tool in your toolbox.
Yeah, it's fine. It doesn't even matter. The reality of it is it's like saying, well, it's an apple and orange. You're not comparing the same things. That's the first mistake. A facelift is not face tight. The whole idea of face tight is it's another option that's not like a facelift, but it gives you a little bit of improvement so you can do a facelift later than sooner. Face tight is also really helpful for people in their 30s that have a lot of fat on their neck and a little bit of loose skin. It's amazing. We've had amazing results with face tight. Accutite could treat those jowls that you don't like in that little area. We could do it in 20 or 30 minutes in the office under local anesthesia. I mean, it's not with very low risk. But that's not a facelift.
And it's not a long-term solution.
It's not a long-term solution. So where's your headspace? Do you want a long-term solution and you're not ready for a facelift right now? Wait, I'm sure you look great. Give it a couple years, revisit again, see if you're ready. Go back to those board-certified reputable surgeons, which is good that you have those available to you. If you want an answer right now that's less invasive, that you can do in the office awake, takes you 45 minutes, face tight's a great option, assuming that you're a candidate for it.
And you understand the expectations.
Right. And that's this really distills down the problem that people have in their heads. And that's human nature. We want to mix and match, right? We want to think these less invasive procedures, you saw a video on either my Instagram or YouTube. We want to think that those will also do a facelift, and they do not. I don't think on our digital channels that we're saying that. If we did say that, or if we implied that to you, then I'm personally sorry, because we've said that over and over on this podcast that they're not the same. But face tight, which Amy would do, which I would do, Nils
doesn't need it.
Yeah, he has a beard though. So face tight is a great option, but it's a great option for people that really aren't ready for a facelift, or don't want to, or don't need a facelift right now.
Well, or for whatever reason, medically can't go under general anesthesia.
Exactly.
I mean, there may be reasons why
or they're just not a candidate. Even they may be, a facelift is indicated, but they're not a candidate for the procedure.
Or they just are one of those people who says, I'm not going to have a facelift, but can you do anything to improve it? Now, in those cases, like, can we do something to improve it? Yes. But as you continue to age, that can you do something to improve it is going to be less and less. There is no substitute for formal surgery at some point. So
I'll break it down. Do you want 10, 20, 30% improvement in the areas of concern, or do you want a 60, 70, 80% improvement? Do you want a 10, 20 to 30% improvement face tight that'll last you 3, 4, 5 years maybe at the most, or do you want a 60, 70, 80% improvement that lasts you 6, 7, 8, 9, 10 years?
Yep.
Do you want something that puts an incision around your ears that technically aren't visible when you go to a competent person, but it would be visible in bright light? Or do you want a surgery with minimal to no scarring at all?
Everybody wants a surgery with no scar, but is that realistic?
No,
in the
I'm
real
saying
world?
or does it bother you? Right. Sorry, that's what I meant to say.
Yeah.
That's when you start breaking it down, and then what you do is methodically you go through it and you figure out what's good for you. Yeah. So, and I think that's what's awesome is to have options. We all and I do this too. You tend to makes you nervous. It's like, oh God, there's so many things.
Well, but not everybody. I think that's the problem, though, is that people think they have options that are maybe not an option for them. They just want it to be.
Okay. But it's also great to at least know that you possibly have an option, right? I mean, like
going to a doctor who actually does both of these procedures is what I would recommend.
Right. Well, that's the problem I have with that office. But I'm not going to throw them under the bus. But the reality is, to carte blanche say technologies don't work, we don't have it. Well, that's complete BS.
Right. And
like you don't have experience with it. What you should do is go to the face tight expert and then go to the facelift expert. See what they both say.
Maybe it's the same
guy. And maybe it's the same person, and then see what's best for her.
Yeah. Yeah. I think too, the financial aspect of this gets challenging with people. We see a lot of patients who come in and are wanting increasing amounts of filler, or they want to do face tight. And at some point in an ethical office, this is where, when you have a lot of tools in your toolbox, one of them being a scalpel.
She just called me a tool.
Box. Yeah. You have that option, right? We have face tight because it's an amazing technology that does work, but we're not telling a 65-year-old or even a 45-year-old that this is going to give them these same results as a facelift ever. It will not.
Right, and we're the weird office that does a lot of facelifts and a lot of face tight.
But on different groups of people.
On different groups of people, and so we can have real discussions with them. And by and large, if someone even is kind of indicated to a facelift, we try to push them toward a facelift because that's the long-term result.
Especially if finances are an issue. You might spend $5,000-$6,000 on face tight, and like Dr. Martin said, like maybe you'll be happy with those results for 3 years because remember, you're going to continue to age, and this was not a definitive solution. Whereas maybe you need to just wait 3 years, save up the money for the facelift, and do the facelift.
Mm-hmm.
You know, you have to decide how long that money is going to be.
It's dollar cost averaging. We have this conversation all the time. Facelifts are a lot more expensive, so people don't want the big sticker price. But then you're going to probably get dollar cost averaging more value from a facelift than you would from face tight.
Oh, 100% you will.
Now, I have this conversation with everyone. And probably a lot of people end up doing the face tight because that's less expensive. You do it in the office under local anesthesia. You walk in and walk out. It's 45 minutes. It's
and a year later, you'll be back for a facelift.
It's less recovery. That's fine. That's more business for us. But we're honest with the patients. We tell them straight up. And a lot of people say, that's what I want right now. And that's okay. That's what this business is all about. Is giving people the real information, empowering them, giving them agency, and allowing them to make the right decision for them right then. Yeah. So if it was up to me, I would make everyone as perfect as I could. But that's not the way this business works.
Well, that's just not everybody's cards. But here's a good question to ask on the opposite of this is there a time when you think face tight would make somebody look worse?
Yeah, I think if you're over 60 and really have loose skin, like really have 60 to 70-year-old pathology.
And if you clear out, if they over lipo.
Yeah, because the fat in that situation at least makes them look somewhat less, sort of a little more youthful.
It's holding things up a
and
little.
You take that out and they're left with this wispy kind of like raisiny skin. It would just look terrible.
Yeah. So technology has its limitations. And
now this gets into the whole thing. You can also do a mini facelift with face tight.
Right.
So.
Or just do a facelift.
I'm just saying, there's so many different middle options.
Yeah, you can add stuff on. Like you can always do more. We've said this many times. You can always do more.
Yeah, and the face tight is actually beneficial to the future facelift. So I tell people that too. I was like, well, that's fine if you want to do the face tight. Just know that's going to benefit you in the future, contrary to what the two offices said that you called.
Or it at least won't make it.
It'll make it better.
Burn a bridge.
It'll make it better. It won't burn a bridge. It will make it better. So it gets into the nuance. It gets complicated, but face tight is not a facelift. So really, the question is, do you want less invasive, less result, more invasive, more result? Do you want the less expensive or the more expensive thing?
Yep. And go to somebody who at least either does both or go to someone who does one of each to get their
It's good that you have reputable surgeons to call, and that's a good thing. I don't want to dissuade you from doing that, and have offices you can go to and trust. I mean, that's what people need.
Well, they haven't seen her as a patient, though, so I don't know if she could say she could trust them.
And did she really talk to the surgeon?
Yeah, so I don't know.
Can you ask me how many times I've talked to people that just called up randomly?
That would be really weird. Yeah, 0. All right. Yeah. So thank you so much for your question. Really do appreciate that.
Would that be funny, man? Yeah. Hi, this is Dr. Martin's office. Dr. Martin here.
I actually have handed you the phone before to answer when a patient was calling, and I knew they were calling you back. And it's still they still are taken off guard. Like it's still not normal.
Thank you for calling my office.
Yeah, it's still not normal.
Is this
the
actual Dr. Martin?
Yeah. No.
I actually wanted to talk to you. Perfect. I don't have to transfer you to me. I'm here.
This literally is giving me anxiety. I can't even hear this conversation happening because of the things that I can imagine.
Oh, you want to schedule? I'll schedule you right now.
Like, just come on over. I'm here right now. I'm not doing anything. Okay. On that anxiety-inducing note, let's take a break. Hear a word from our sponsors while I go check my blood pressure.
And I'm going to check. I'm going to get checked. Let's get checked.
Let's get checked.
Yeah.
Dr. Martin, I'm super excited to talk about our sponsor for this podcast, Let's Get Checked. If you've been a listener of our podcast, you know that we have never had a sponsor before, and that's because we're an educational podcast. We're not looking to monetize, and we also would never recommend something that we didn't believe in and or use ourselves.
So basically, you're saying we're very choosy.
We're very choosy when we come to our testing, but Let's Get Checked really aligns with our values. We talk a lot about monitoring your blood values of certain things. We talked recently about vitamin D serum levels. We talk a lot about hormone levels, and it's hard for some people to get to a lab, or you're afraid of the blood draw, or just, you're concerned about confidentiality. Like you have a lot of concerns and you just don't do it. Let's Get Checked makes it super easy because it's completely confidential. You do it from your home. So there's really no excuse not to do it.
Yeah, and we did it recently. Both Amy and I did it. She looked at her women's health, basically her hormone levels, and I looked at mine on the men's health side with testosterone. It was very simple. You go online. Their online interface is really easy to use and good. We got the testing kit very quickly. And the test itself, actually doing the stick, you do a stick on the end of your finger, is not hard to do. It only took about 3 to 4 minutes. You put it back in a sealed envelope that's confidential, goes back to them. You get your results in 2 to 5 days. It's really that simple. And the best part is it's about empowerment, about you taking control and trying to do things that are positive for your health and life. And this is one way to do it literally from the comfort of your own home.
Yeah, so they offer a wide range of tests. So they do men's and women's hormone panels. They do a full panel of STD testing. They also are now offering a COVID-19 test at home. So there are a lot of other just basic blood levels that you can get tested as well. And one of the things that we always say is you can't track what you don't check. So you might not know what's normal for you in the future if you're not checking it now, especially as it relates to hormones. And men's health specifically, I feel like is a little bit undertreated. I mean, sperm counts are dropping by a large percentage in men these days. Most men struggle at some point in their lifetime with low testosterone.
And those men do not know what the symptoms of low testosterone are. Depression, anxiety, sleep problems, osteopenia or loss of bone, loss of muscle, and something we treat all the time, gynecomastia or male breast growth. These are real problems that can be improved or treated with testosterone. And these men do not know their levels. It's so easy to get checked. And this is why we're so excited about the sponsor.
Yeah. And Let's Get Checked is a completely CLIA certified lab, the CLIA lab. So they're a well-established, completely safe lab to use. You do get contacted after, so you get your results. I got a text at 4:30 in the morning, which I loved, that my results were ready.
And we're both up at 4:30,
yep,
so that was good.
Super excited. And you have access to not only a nurse, but also a physician. So a physician does review your results, and it gives you a little breakdown of like where you're sitting on those levels. Dr. Martin's had even comparisons of like where two of the levels should be in relation to each other, which is a really important thing to note.
Right.
Just being within the normal range is not always enough. So it really gave more information than that. You'd still want to, of course, reach out to your own doctor if you needed some additional assistance with these labs or you did see something that was concerning. We didn't, thankfully, so that was good.
Yeah. We were both good. This podcast is about empowerment. It's educational. In my private practice, I'm a board certified plastic surgeon. We are all about empowerment, and this is one way to do it. So we're very excited about the sponsorship, and we're looking forward to using it for our patients moving forward.
Yeah. So as a listener of our podcast, if you're also a new time user to Let's Get Checked, which a lot of you probably are, we do have a 20% discount code. So you do need to go to our specific URL, and it is linked in the description box below, but it's going to be TryLGC, so TRYLGC, like Let's Get Checked.com/beauty, BEAUTY. And you'll need to use the code BEAUTY20 at checkout. Beauty again is BEAUTY 220. And you can pick a test, like any test you'd like, put in our code and get your test shipped to you. Getting tested is the right thing to do. It's lets you know where you're at and what's responsible.
All right. Well, let's get tested.
Let's get tested. Let's get checked.
Let's get checked.
And we're back. Feeling much calmer now.
Do you feel better?
Feel better. Yes. All right. So let's get back into the questions. This next question actually came via YouTube, and it was a question left on our thigh lift episode.
I love it.
Yep. So this question was from Holly, and she said, how many procedures should a surgeon have under their belt before one should consider a particular thigh lift?
So interesting.
And I answered this question on YouTube. Thank you, Holly. But I thought it was such a great question and had a really good question to ask. And the way I answered it on YouTube, I'll just say that first and I'll let you kind of answer it, was basically just to say that there is no set number. There are competent surgeons who may not do a lot of specific surgeries a year, but are so skilled that it's something that they can do, even if they only maybe do a handful a year. Whereas another surgeon who may not be very technically skilled, this might be the thing that they are passionate about and say that is their primary surgery, but they still might not be very good at it. So overall surgical skill is what I encouraged her to look at. Like, look at the surgeon's entire portfolio, see their overall surgical skill, and make sure that they do have at least a moderate level of competency in this surgery. I think the thing that we all kind of want, right? You want to find the expert, right? So we talk about this on our episode about board certification. There is literally nothing that prevents any doctor from calling themselves a plastic surgeon, from calling themselves a cosmetic surgeon, from calling themselves an aesthetic surgeon.
An expert.
Yep. So they could literally say to you, I am the
How is this helping Holly?
Expert. It's more buyer beware. So like someone proclaiming themselves to be an expert in something does not make it true.
Right.
So how would you answer this question?
Yeah. So thigh lifts are not a common procedure. Like you'll have certain practices. We do probably more than
I say we
average.
Do a moderate amount for the area of the country that we live in.
More than average for my contemporaries. And so you're not going to have someone who you could put it like a quantifiable number that it could be like huge. At the same time, you got to have someone. I think the better question to ask: do you do these on a regular basis? Do you do a couple a month or a couple every other month? Is that something that you're comfortable with? Do you have patients they've done it before? Can I talk to those patients and see what their experiences are? Can you show me those photos? I think that gets down to the nitty gritty. I do think volume does matter though. Amy's right. Like you can't, even though I've been fortunate to be technically a good surgeon, I think, getting a lot of cases under my belt, specifically related to thigh lift, does make a difference. Mm-hmm. So
for those bigger surgeries.
Yeah. Mm-hmm. In the surgical world and low volume cases, you're talking, at least 50 to 100 in their whole career is a lot for low volume cases. Mm-hmm. So, but I'm sure there's people out there that have done hundreds and hundreds. If you're part of a plastic surgery practice that deals with bariatric patients, the weight loss patients, and those patients by and large tend to have a lot of laxity of their thighs, and maybe that's your specialty, post-bariatric surgery, body contouring with plastic surgery, then maybe you've done hundreds of those cases. I can't imagine someone would do 1,000. Now, you could do 1,000 breast augmentations because those are high volume cases. If you just do nose jobs, you could do 8 of those, 9 of those a day. So you could get upper eyelid blepharoplasties, really quick procedures. But thigh lifts tend to be pretty intensive, work intensive, and take a long time. So, but it is hard. It's really, really hard. We feel for our patients. We're fortunate because we've been around for a while, so we have baseline street cred and people kind of know what they're getting into, so it doesn't feel as much of a question mark to them. But if you don't have that luxury, you don't know someone, and going into somewhere cold, I would feel the same way. So you're kind of looking at this person like, okay, how do I judge this?
Right. Yeah, and unfortunately there is no set number. But a surgeon, looking at their overall results of everything, so they may not do a huge high volume of the surgery you're thinking about, but they've done enough. And then the rest of their surgical portfolio is very good. I think that's going to give you the best idea, specifically in a surgery that has a lot of scarring, like a thigh lift. I would also want to see their tummy tuck scars, because how you do one thing is how you do everything.
Yeah, that's a good point.
So if your scars from a tummy tuck look really bad, and that's a relatively uncomplicated surgery, I would then maybe think that their thigh lift scars might not look so great.
Well, the other hard part about thigh lift, it's really hard to show the scars because you're basically showing their genital areas.
Which you'd probably only show during a consultation, not online.
Yeah, but even that, it would be, I don't know, it's really hard to see. It's in an invaginated area. So, you could see the overall contour. That's very helpful. Yeah. I think baseline 50 to 100 cases, and then from there, it just depends on the volume of the procedure. I don't think you need hundreds and hundreds and hundreds of procedures to be an absolute expert. I think that's a misnomer. I think 100% that's a misnomer. I mean, literally, for me, my comfort level is maybe 5, 7, 8 cases of really kind of getting down something new, and then I feel pretty good. You have to get 10 or 20 more after that.
But that's also because you have overall thousands of surgeries under your belt. Yeah, and that's what I'm saying. So your ability to know how to inset something, to know how much tension to put on sutures, that translates across surgeries.
Yeah, that's true.
So
I don't think about it that way sometimes.
Yeah. I mean, that's why I said look at their other pictures of scars. Mm-hmm. Those things will transfer across the board. So yeah, I thought this was a great question.
That's a really good question. And I don't think we've totally answered it, but I don't know, pick a number, 75, 100.
Answerable. Yeah. No, but that's just it. It's not entirely answerable. And that's where, getting multiple consultations and really
the other part about numbers is how could she qualify that?
Right. That's why I said you might have someone who says their specialty and they've done hundreds, but they all kind of suck.
Or what if they said they've done 300, they've only done 3?
Right.
You wouldn't know the difference.
You would not.
Yeah.
No, you would not. And again, people are not always honest. Go back to listen to our podcast about board certification. The doctor, there's no... There's a code of ethics in board certified doctors, but in non-board certified doctors can kind of call themselves whatever they want.
Yeah, they can do whatever they want.
Say whatever they want and tell you they've done lots of something and haven't done any.
They could say they're a plastic surgeon.
And not be.
Yeah, which happens all the time.
Yes, so patient beware. That's why consultations matter. Get more than one. Find somebody that you're really comfortable with overall as a surgeon, and then, get down to the details of the surgery you're interested in.
What's next?
All right. So our next one is actually from a podcast or an episode about direct neck excision. And we posted a picture on that episode of the patient 7 days after surgery. And Red Rum asked, will the puffy red scar in the after photo go away? And the reason I was glad that this happened was this patient had come in for a follow-up. So this is now a picture 4 months later. And he had shaved that day. So he'd actually nicked himself shaving, and that's why there's one little tiny red dot along the incision line, which is really kind of the only way you can even pick the incision out of this picture, is because there is a little red spot on it. And it was because he had nicked himself shaving. And that scar is, it is going to be more sensitive for even a year after surgery, and he's not even 6 months out from surgery. But yes, even 4 months later.
4 months, he'd still have a red visible scar. I mean, that's the part of healing. That doesn't go away. You just don't have a disappearing scar that early. So the fact that he looks pretty good even with the nicking just shows you, it's going to get better.
Yeah, but the way the scar looked like at 7 days after, when it is still kind of like a little more raised and inflamed, was just because it's raised and inflamed. It was a brand new incision.
Yeah.
So the puffiness is gone. You do still kind of perceive that incision slightly, but I think most people looking at this after, if you said, what surgery did this person have? I doubt any of them would say he had a direct excision neck lift that made an incision all the way down his
it's his clavicle. It's his clavicle bone.
From his chin.
Yeah.
So, yes.
I mean, that patient specifically is like the best thing I ever did.
Yep.
Like, he always comes in with like golf shirts on and like things that open neck, open collar.
That he couldn't wear before because it.
Yeah. And you can't see the scar.
Yep. Well, and he hated wearing collared shirts before because his neck skin would hang over it. So, yeah.
I get it. Like a direct excision neck lift, for sure. The big concern is the scar. And I get that. And I guess you just have to trust us. Like, by and large, these scars look amazing. So I don't know. I mean, that's technique. It's the location of the incision. It's the healing process, picking the correct patients that are healthy. I don't know. I mean, but
surgical skill, maybe just a wee
dash. A little bit, yeah. But Red Rum was like, I wasn't feeling that red puffy scar.
Wee dash a surgical skill.
When you say things red, puffy, angry, crying.
7 days post-op was in that previous picture.
People hate, but I kind of like it. I like it. I mean, bring it on. Yeah. I'm ready.
I mean, this is the truth, though. We have a great episode where we talk about scarring in general.
Yeah.
Scars are a long-term process. Like, the acute phase of a scar is the first couple of months. A scar isn't fully matured for up to 2 years. Like, your body is actively working on this scar forever, for your entire life. I mean, think about it. When you looked in the mirror a year ago, you saw you.
I looked way better.
But you were you.
Yes.
How many of your cells do you think are different in your body today than they were a year ago?
Philosophy, cell stuff.
This is not philosophy. This is biology.
I know.
90% of the cells on you today that make you
different from a year ago.
I'm
not even the same person.
But you are. So all those things, your scars, anything, this little scar right there,
like pointing out my chickenpox scar.
Your body had to do that again.
My son asked me, he's like, why do you have that scar there? I'm like, chickenpox. He goes, what's that? I'm like, you're so young.
Right? I know. It's like the smallpox scar, remember? When I was a kid, I was actually so envious because I was in the generation just missed getting the smallpox injection, and it left that big pockmark, remember?
Yeah.
And I saw it on like all my, everybody had one. I was like, oh my gosh, it was the Starberry Sneetches all over again. Why don't I have that scar? Yep. So scars go away, and your body is pretty amazing. So I think this is remarkable that at 4 months, this scar looks as good as it does. Bodies are freakishly amazing. I think when they say that like our bodies aren't self-healing, like they absolutely are.
Yeah, we're like Wolverine.
We are. It just is slower than Wolverine. And eventually it slows down all the way, but that's why we die. Sloverine. That's aging. It's Sloverine-ing.
I want an episode about Sloverine.
Yes. So as we age, all those processes slow down. But in the interim, it's pretty remarkable that you are only 10% of the cells you were a year ago, and yet you look exactly the same.
Yeah, it weirds me out.
Your hair, your nails. I mean, like literally everything is replacing itself.
You
all
always
the time.
say these kind of things weird me out a little bit. I don't know why. I mean, I'm a scientist. I get that.
Yeah, it's awesome. It's the body.
But it's kind of freaky.
It's amazing. So thank you, Red Rum, and I hope you caught this episode. And I
don't think Red Rum cares. I think he just wanted to exemplify the red puffy scar.
He was trolling?
But I kind of like it.
Yeah.
I mean, it's true, though. The guy had a red puffy scar. It was 7 days afterwards.
Yeah. And 4 months later, it looks like this. And maybe in 6 months, we'll get
another 6-month photo for Red Rum.
Yes. All right. So thank you all so much for these questions. I loved the variety, and they were all such really good questions. And I think really will be helpful to anyone listening to this, especially talking about, the fat question comes up all the time. Knowing how to select a good surgeon is very key.
Oh, huge. Yep. We have an episode on that too, selecting your surgeon. So
that's an OG episode. We need to redo that, selecting your surgeon.
Maybe we'll redo that.
That was before video. You got to listen. Just an audio. That is audio only. That was on 255. Yep. So we do have, if you're watching us on YouTube, we do have an amazing library of episodes that happened before we were recording them on video. So you should definitely check us out on Spotify or the iTunes podcast app, wherever you listen to podcasts. We are there as well. You got anything else to say before I do my spiel?
I do your spiel first, and then I'll say something.
Oh, you're gonna do this is the like you do this. It's like the recap.
I know. I like to do what I do.
Yeah, like it's
Amy,
like
I'm the talent. Okay. I need my space.
All right, but I like finality. All
I
right,
know. Some of it is your OCD, and when I just kind of dig the knife in a little bit.
Well,
Keep
these
going.
are, you know what though? These are like the nuggets. So they probably think, oh, the spiel is over. There's nothing good coming. I will tell you this, listener.
Every Marvel movie, you have to wait for the credits to go,
Yes.
and then you get the sneak peek at the next movie.
This podcast is the exact same way. So I'm going to do
You
my
have to watch it
spiel.
all the way through. That's good for our YouTube
Yes.
analytics, by the way. Too.
So if you'd like to be on our next episode of Listener Questions, you should leave us a voicemail or a text message at 303-630-9038. You can also send me an email. My email address is in the box below, or reach out to us on social media. We're on all social platforms at Jason Martin MD and at Beauty and Surgeon Podcast. Take it away, Dr. Martin.
I do think listener questions are the kind of embody why we do this podcast, by the way, because we want to get really fun and good information out there for people who are interested in making themselves look better.
And we need to know what you want to know about.
But also at the same time, that interaction really tells us, okay, we need to steer the ship over here and over there. So we've grown so much with this podcast. You can see in our numbers on the YouTube channel and on the different podcasting platforms, which are what? Which ones, Amy?
What podcasting platforms exist? Oh, there are thousands. Stitcher, iTunes, yeah. Wherever you find podcasts.
Wherever you find a podcast.
Spotify.
Yeah. So, but it doesning mean always that we're giving you information that you need. So thank you so much. It means a lot to us for people to reach out. Even Red Rum. I like Red Rum's question.
Mm-hmm.
I actually would go grab a coffee with Red Rum.
I'm just going to leave that there.
Okay, that's good.
Yeah. You have not ever had to internet date. That's why you say that.
Catfish.
Yeah. Welcome to the world of chaos online. Like, you don't trust a stranger. That is a stranger.
He's
Loyal
a
listener
listener.
of the
He's a
podcast, but
listener. He's a
stranger.
listener. Red Rum's a listener.
Yeah. Oh, my
He's not
goodness.
a stranger.
You would never let you loose on a dating app.
Who was the
Oh,
guy that
my
was asking
goodness.
that really complicated question
Dave.
about
I think that was Dave.
Dave?
right?
I'm convinced that guy's a medical student.
He wrote back that he is not a medical student.
I still don't believe Dave.
Yeah.
All right.
Well, that was a good one. And I know now to make sure that I don't ever let you get on an app where you're going to meet people. Oh, they seem totally fine online.
Well, apparently
They
I can't
look
answer the
nice.
phones. I can't get on apps.
They look so nice.
I feel like I'm just, banished to my room.
Oh, my goodness.
All right.
All right. Thanks so much, everyone, for listening. We hope to hear us here next time.
Hear you here.
Don't forget to check out our sponsor, Let's Get Checked. Let's Get Checked offers fast, affordable, and completely confidential health testing for everything from STDs, male and female hormones, and even COVID-19, right from the comfort of your own home. And remember, new customers and listeners of our podcast get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com/beauty and use the code BEAUTY20, beauty, BEATUY 20 at checkout. Get checked. It's the right thing to do.